The senator representing Borno Central Senatorial District, Kassim Shettima, on Wednesday decried the lack of federal government's presence in Chibok, Goza, and other communities in Borno State. The senator said this during a public hearing by the House of Representatives Committee on Health Institutions on 10 bills geared towards establishing new tertiary health institutions in various parts of the country. Senator Shettima, who was a former governor of Borno State, complained that the two federal constituencies of Damboa and Gwazo, Chibok and Askira Uba Hawul do not have any federal presence. He said this at the hearing to support two of the bills to establish a Federal College of Nursing, Midwifery and Health Science in Chibok and to establish a Federal Medical Center in Gwaza, both in Borno State, so as to give meaningful life to people of these areas.
Issue of the federal presence in Goza, Damboa, Chibok federal constituency. The agitation started right from the days when Right Honorable Dr. Asebe Bidita Bashir was the member representing that constituency. His successor sustained the tempo, and finally it has seen the light of the day. But she made her own incremental input. This is why she is here to identify fiercely with the project. But most importantly, the optics are wrong, are terrible. Those two communities are in some sort of a time capsule, and they are right at the doorstep of the famous Sambisa or infamous Sambisa forest. So we have a moral obligation to identify with them, to support them, and to see to the establishment of those institutions in those two localities.
This bill is apt. We really need it, as you heard from the previous speakers. Goza local government is one local government that today is densely populated, and we have only one hospital that is catering for over 100 million people. And like one of the speakers said, this hospital was established way back in 1942. And since that then, there has not been any health institution in the local government.
The chairman of the committee, Honorable Pascal Lubi, said the hearing was to get input that would help to guide operations and establishment of tertiary health institutions across the country.
Again, will it be in the interest of the nation that that place becomes upgraded to a federal university teaching hospital? If we continue to say there is no money, there is no money, there is no money, and people are dying, we don't have enough hospitals, we don't have enough health medical practitioners to take care of our health needs. When you consider the relationship, the ratio of health personnel to the number of the population they are caring for, you see that it is a far cry from what is expected going by the WHO standard. So that is the thing. We have heard you, but we are still the legislative arm of government. We must continue to exercise our legislative functions.
It is believed that with all this input, that federal presence will be found in Borno State to bring an end to the menace of banditry in the state. Annie T. Patrick, Core TV News, Abuja.